Last week, South Africa commemorated Breastfeeding Week. The week is a global campaign which supports and promotes breastfeeding as a cost-effective tool to ensure child survival. The country commemorated this year's campaign with the theme Support Breastfeeding for a Healthier South Africa, with a special focus on how breastfeeding is particularly affected by COVID-19. Joining us this morning to tell us more about how this year's Breastfeeding Week played out is Acting Chief Director for Child Health in the Health Department, Dr. Lesley Bramford. Dr. Lesley, thank you for your time and thank you for joining us on Weekend Dawn. What was the meaning of this year's theme?
Good morning, and good morning to the viewers. So, as you correctly said, this year's theme was Support Breastfeeding for a Healthier South Africa. So, we know that breastfeeding gives children the best start in life. We really want to see that all children are exclusively breastfed for at least 6 months, because, as I say, gives them the best start in life. So, by exclusive breastfeeding, we mean that children for the first 6 months of life should receive only breast milk, because that is all that they require. So no other fluids, no other solids. Exclusive breastfeeding for 6 months. From 6 months, children require some introduction of what we call complementary feeds, but we recommend that they continue to breastfeed until the child is at least 2 years of age.
Now, what would happen with a mother who can't breastfeed for health reasons? What options would be available out there for mothers who need to still feed their newborn babies?
So there are options available, but I think it's important to say that the number of conditions where mothers are unable to successfully breastfeed their infant are very small. There are some mothers who have quite serious health conditions, but it really is a very limited number of conditions. With regards to COVID-19, there currently is no evidence that COVID-19 is found in breast milk, and in line with World Health Organization recommendations, we continue to recommend that mothers with suspected or confirmed COVID-19 continue to breastfeed their babies. They do need to take precautions. They need to wear a mask. They need to wash their hands with soap and water regularly, and they need to make sure that any frequently touched surfaces are kept clean and disinfected. So in fact, the recommendations that everyone should be applying in these times. Of course, there will be a very, very small number of women who have COVID-19 soon after they're delivered, who may be too ill to breastfeed. In those cases, we would recommend, if possible, that the mother still expresses breast milk, and this can be given to the baby. We do also have breast milk banks in South Africa, and those milk banks currently have supplies of milk and can be contacted if there are mothers who are too ill to breastfeed.
I'd like to look at something a little different from COVID-19 and just general breastfeeding. What's the play on the stigma around women breastfeeding in public? What's the thinking that people are shunning it or looking or frowning or looking down upon it? What's the thinking there and the mentality? How do we change the mentality around that?
Well, unfortunately, as you point out, certain people do believe that it's not appropriate for mothers to be breastfeeding in public, for example. Our position is very clear. Breastfeeding is completely natural, and any baby should be able to breastfeed whenever the child needs to breastfeed, wherever, whenever. It's really about the baby's nutritional and other needs. But we do recognize, and we are working with a number of partners, so both from the department but also with civil society, to try and change people's attitudes, to make it more acceptable for women to breastfeed whenever they need to.
How did the campaign roll out last week as opposed to the previous year, considering that things like COVID-19 have obviously affected plans to roll out the way you initially had planned?
So, Breastfeeding Week was celebrated in various ways. On Tuesday, we had a virtual launch by the Minister of Health, and that was very well attended. Um, and then in our provinces, celebrated Breastfeeding Week in different ways. Um, Obviously, much more emphasis on virtual meetings, on communicating through social media and other platforms. Um, but there seems to have been quite a buzz, and we are hoping that the message got out. We have been trying to use Breastfeeding Week as an opportunity to encourage caregivers to access our health services. We know that our immunization rates, for example, have fallen in recent months. We understand that parents might be anxious to go to health facilities, but we want to send a very clear message that our health facilities are open, mothers and their babies will be safe, and please take your children for immunizations. We are concerned that if we don't get back to our normal levels of immunization, that in the months to come we will start seeing outbreaks of vaccine-preventable diseases. And in fact, these are much more potentially harmful to children than COVID-19 itself.
Now, a week like this, does it get the full support of government and other organizations? And if not, what can government do to make people a lot more aware of it and the importance of a Breastfeeding Awareness Week?
We think that awareness is increasing and that most people are now aware that breastfeeding is definitely the best option. That said, we know that mothers need support from a range of people to successfully breastfeed. They need support from our healthcare workers. Very importantly, they need support from their families, particularly their partners, but also other household members. They need support from their communities so that they can breastfeed whenever, wherever. They need support from employers. Mothers who are going back to work need to be aware that employers are obliged to give breastfeeding mothers 2 30-minute breaks during the working day, in addition to normal breaks, to allow them to breastfeed or express breast milk to take home for their baby. So really it requires action on a whole range of levels, and so that's why we promote and support and protect breastfeeding throughout the year, but we do try and use World Breastfeeding Week as an opportunity to inform and remind all the stakeholders about the role that they should be playing in ensuring that all our children benefit from breastfeeding.
Dr. Lesley Bramford, we'll leave it right there. That was Dr. Lesley Bramford, Acting Chief Director for Child Health at the National Department of Health. She was talking to us about Breastfeeding Week, which was observed this past week to emphasize the need for a healthier South Africa, even amid the COVID-19 pandemic.